question? Right. Right. So if you read and understood, considering it examination station, please begin.
Okay, ma'am. So my candidate number is 9123.
Yes.
Hello, my name is Dr. Mahmood, one of the surgical doctor. Can you confirm your name and age, please?
Yes, I'm Linda, 23 years old.
Okay, nice to meet you, Miss Linda. So today I have been asked to examine your shoulder, which will
Yes.
include to have a look, feel, and some movement. Are you okay with that?
Yes.
Okay, so before starting, do you have any pain on your shoulder?
Yes, I do have pain, but it's okay.
Okay, so I'm sorry to hear that. Do you need any pain medication?
No, that's fine.
Okay, so now for the purpose of the exam, I have to open your gown. So
Okay.
do you need a chaperone?
No, that's all right.
Okay, thank you. So I will try to maintain your dignity and the privacy. Okay, so let me have a close look of your shoulder. So at this point, I will have a look from front, from side, and from the back. Okay, Miss Linda, so now I have to feel your shoulder.
Yes.
So at this point, I will start to check temperature on the both shoulder joint with my dorsum of the hand. Then I will start to feel the clavicle on both sides. Then slowly, I will go to feel the shoulder joint, acromion process, then shoulder girdle, and scapula as well. Okay, so now I have to do some special movement.
Okay. Go ahead, please.
Okay. So I will just follow me what I am doing. So in that position, I will do the movements of the shoulder. So at first, I will do flexion, then extension, then abduction, then adduction, and then I will do the circumduction.
Okay.
And so this is initially we have to do like active movement, then I have to do a passive movement. So what you have done, so just I will do it by myself.
Okay.
Okay, so the same thing, I will do all those 6 movements. So,
Only
and
on
then
right shoulder, or you have to
so
tell
the
me this.
passive movement, ma'am, I should do only the affected shoulder, right?
First active movement patient has done on both sides. Then you're doing
Yes.
passive movements also on both sides.
Oh, passive movement also on both sides.
Yes.
Okay, ma'am. Okay, so after the passive movement, now I have to do some special movement. So at this point, I will do empty can test and painful arc test. So I will ask the patient to raise the hand, and then I will ask him, can you please move the hand a bit forward and then try to empty the can.
Okay.
Yes. And then I will ask the patient to do the painful arc. So I'll ask the patient, can you please raise your hand as much as possible? So, so the patient should make a arc, this complete abduction of the shoulder joint.
Yes.
And then at this point, I will do external rotation against the resistance. So I will ask the patient, can you please, can you please bend your elbow and then push it outside and don't allow me to push it in.
Okay.
And then I will do external rotation in abduction.
Yes.
Yes. So I have to take the hand up and then I will ask the patient to push it outside. So then I will do the internal rotation against my resistance. So I
Okay.
will ask the patient, you can try to cross your hand opposite side of your body and don't let me push it outside.
Okay. What else?
Yes.
Continue. You've got just
So now I have to check the sensation of your hand.
right.
So I will feel this cotton. So at this point, I will touch this cotton on her sternum, and I will ask the patient. So you will tell me yes if you feel the same touch on your hand. So I will at least do on C4, C5, C6,
Okay.
C7, and T1.
Right.
And
Thank you.
every time patient will ask for
Mhm.
yes.
Can you please summarize your examination now?
Okay. So today I have been examined this 23 years old lady called Linda.
Yes.
So on examination, her on inspection, there is no wound, there is no scar, and on palpation, no high temperature, and on movements, so is some limited range of movement of the right shoulder joint.
Yes.
Uh, Otherwise, no other positive findings. So to complete my examination, I will do a complete neurological examination and elbow joint and hand examination.
All right. Okay. Please tell me what investigations would you ask for to confirm your diagnosis?
Okay, so I will start with a plain X-ray of the shoulder joint,
Yes.
posterior view. Then I
Yes.
can go for MRI of the shoulder joint. Then we can do FBC, CRP, ESR to
Yes.
exclude any connective tissue disease or inflammatory disease.
Yes. Okay. Right. What treatment or management can you suggest her?
Okay, so for management, we can give a arm sling and to have rest for a few days, and then if there is like a frozen shoulder or something, then I will send the patient to the orthopedic surgeon for definite management. Maybe we can do either hemiarthroplasty
Yes.
or replacement.
Okay. Please tell me, patient is a professional athlete or elite athlete. So when would she be able to return back to her swimming game?
So if it's frozen shoulder and if there is no
It's here, impingement. It's not
okay
frozen shoulder. So
okay so like after uh, rest of the 6 months using arm sling, then if the pain is subsided, then maybe the patient can go back to swimming.
okay, right. So 6 months you said with
Yes,
rehabilitation
yes, ma'am.
should be 9 to 12 months at least.
9 to 12 months. Okay.
Yeah. Okay. So right. Thank you. Now wait.